January for the past several years, Point of Care Partners has made predictions about key trends that should affect health information technology, or health IT, electronic prescribing or e-prescribing, and the exchange of various types of health data. Now that 2018 has come to an end, let's take a look at those trend predictions and see how they panned out. First, tell me about this article you wrote for HIT Perspectives, the Point of Care Partners newsletter that people can subscribe to and download right from your website. Why'd you do it? And what do you hope to accomplish? Do you do this every year?
We do. Thanks, Lisa, for asking. We do it every year. In fact, we've been doing it we've had the newsletter really since the company started 16 years ago. We have been doing this prediction, I don't know, for 8 or 9 years, and it's always the best read, sort of piece that we put out there. It always has the most readership. So we know that people want to know kind of what our predictions are for the year. Perhaps they use that in making their own, determinations and figuring out where they want to place their bets. What we're doing this year that's different is we're looking back and we're saying, were we right? Were we wrong? Were we off? Were we right on? Or were we a little ahead of ourselves? And those kinds of things. And when we did that, in fact, it turns out that in 9 cases, 9 of the 13 predictions, we felt like we were right on. 2 of those, we thought, we were maybe just a little bit ahead of things. And then for the last one, or the last 2, I guess, we really felt like we're probably a little aggressive, a little far ahead.
The ones you were slightly ahead of yourself, those interest me because they could be 2019 trends. So tell me about those.
Yeah, there were a couple that we were just a little ahead of ourselves on. One was patient identifiers. That's really a situation, to do what we call interoperability, really the exchange of health information that's really linked to a patient, an individual patient. We need to have sort of rock solid identifiers. Now, the federal government is prohibited by law from creating such identifiers. So private companies have worked on having those or putting those in place. And we made progress, but not as much progress as we anticipated or expected that we would make. The other one where we were just a little bit ahead of ourselves was electronic prior authorization. Electronic prior authorization is sort of the process of insurance companies approving a drug, a therapy, or a device for a patient prior to the patient receiving that drug, device, or therapy. And we have been working on that actually for about 14 years, but that's more on the pharmacy side. On the medical sort of device and procedure side, we haven't made as much progress, and we thought we'd make more in 2018. What we found was progress, a lot of activity, but we didn't make as much progress. We didn't make get as far along as we thought we would. So more than likely, those 2 are gonna be, front and center for next year as things, as trends that will really begin to where the industry will really begin to make progress
and come to the forefront. That's great. Okay, let's talk about the areas where you were way ahead. The first one being biosimilars.
Yeah, biosimilars. What they are is, for expensive and complex biological therapies, biosimilars are kind of alternatives to that. You could use an analogy. They're almost like, say, a generic to a branded medication. We thought that we'd made substantial progress in that area this year because the FDA had said that they wanted to make progress in that area because the Trump administration wanted to introduce those as a way of sort of, keeping costs under control. And we found, that we didn't make quite as much progress as we anticipated or expected. But we really think that 2019 is probably going to be a big year for biosimilars.
Right. And because they're very expensive to manufacture, so the cost savings isn't that dramatic. So that's why also the U.S. has been slow in rolling them out.
That's true. That is very true. They're expensive to make. They're expensive to develop. And the cost savings isn't as much as what we expected. there are also potential complications. So the FDA just wants to be really careful to make sure that the therapies that we roll out, the biosimilar therapies that we roll out, are efficacious. And we also want to make sure that if there are any adverse events, they're traced back to the appropriate, biologic, and that could be a biosimilar or the source biologic as well. So we're making progress in that area, but we didn't get quite as far along in 2018 as we expected.
Great, thank you for clarifying. And now next, how about blockchain?
Yeah, blockchain is a new technology that was introduced to the market. I don't know, it hasn't been more than 4 or 5 years. Um, it's where blocks of information are sort of put together to really create a secure and private transaction. It's really ideal for healthcare. Um, it was introduced in another industry in the cryptocurrency area for bitcoins, for Bitcoin, for example, and they made a lot of progress in the technology. So we're now beginning to look at rolling that out in healthcare. We think we're going to make substantial progress. We didn't make as much in 2018 as we thought we would. One of the challenges to blockchain is that you really have to get all of the pieces, all of the stakeholders involved have to buy in before you launch. So as a result, it's blockchain is going to take a little bit longer to get to the market. The Gartner Group has what they call a hype cycle. And in their hype cycle, we're sort of at the top of it where everybody's talking about this, but we haven't really, sort of substantially implemented blockchain. They predict that we're about 4 or 5 years out. And so 2019, we think we'll make more progress, but we still probably are a few years away with blockchain.
So you might be talking about this again next year in 2021, 22, and by then it might be really hitting the health information technology sector.
Very likely.
Okay, great. Thank you so much, Tony, for taking the time to look back at Point of Care Partners 2018 Health Information Technology Key Trend Predictions. And you clearly have the gift of health information technology precognition. So it'll be interesting to see what happens in 2019 and beyond.
Well, thank you, Liesl. Appreciate you sort of taking the time and again, 2018 was a wonderful year, and I'm looking forward to 2019. It's going to be even better.
Great. We'll talk to you then. Thank you so much, Tony.
Thank you, Liesl.